Good day. My name is Audrey Ludig. I'm the Program Development Manager for CHOC Childhood Cancer Foundation in South Africa. Welcome to our second webinar in a series of 3 on promoting healthy body image and sexuality in pediatric cancer patients. CHOC's mission is to support children and teens with cancer or life-threatening blood disorders and their families, improving early detection and augmenting effective treatment. It is important for us that all children and teens with cancer or life-threatening blood disorders and their families feel they have access to comprehensive care and support, and that they feel that they are not alone and they are supported. One of our goals is post-treatment support, and that includes continuous support to our survivors. So during a focus group discussion and individual conversations with our long-term survivors, it became very clear that one of the many struggles they experience is a healthy body image and sexuality. And therefore, we've decided to host this series of 3 webinars on the topic. We sourced international experts, brave soldiers, survivors who are willing to share their journeys and their experience with us. And we invite you as part of the webinar to share your, to take part in this conversation by putting your questions in the chat, and we will try to address that as far as possible. So during the first webinar, we spoke about fertility and sexual aspects in pediatric oncology patients and long-term survivors. We had 3 experts from the Princess Maxima Center for Pediatric Oncology in Utrecht, and Helene van der Poel spoke about the late effects of childhood cancer on fertility and sexual problems. Then Irene Igoshi, she's a nurse practitioner in oncofertility. She spoke about the possible effects of childhood cancer treatment on sexuality. And Dr. Marianne van der Wettering, she shared new trends and developments in fertility. And then we had a survivor, Zuki, who shared with us her miracle story on how she became a mother. Now, if you missed this webinar, you are most welcome to catch up on YouTube. So during June, we celebrate Survivors Month. And today we ask the question, how do you speak to adolescents and young adults about their sexual health? We have a few survivors who are willing to share their experiences with us, and I'm humbled by their boldness to speak on this very sensitive topic. We also have Mandy Rodriguez, a clinical psychologist and life coach at Medfem, and she's going to talk from a personal and a professional perspective. Now, okay, you didn't come to listen to me, so let me introduce our first speaker tonight. Our first survivor is Jennah Dollman. Now, Jennah was diagnosed with acute lymphatic leukemia in 1995 and was treated at the pediatric oncology unit in Tygerberg Hospital in the Western Cape. And that is actually where I met Jennah and her parents. And Jennah, it's such a privilege to have you here with us today. At that stage, she was only a toddler and couldn't recall much. Her treatments were stopped, and 3 years later, she were on maintenance. And that stage, she was about 7 years old. Jennah said that while she may not remember everything during the treatment and maintenance phase, she does remember a few vivid images and memories. And those memories are the senses of situations that you put it so beautiful, Jennah. It's rather than facts. It's the emotion, the feeling of that experience. And as she said, it's actually a blessing in disguise that she didn't know the facts, but that she just lived through that. Now today, Jennah's busy, as you can see, with all her pups and wonderful Yeah, she's busy with her master's in obstetrics. And we are very proud of you, Jennah. And I am very thankful that you are with us today. Welcome to be part
Always
of
a
this.
pleasure, and thank you for having me.
So, Jennah, I'm going to ask you a few questions. And please, everybody, you must remember to put your questions in the chat if you want to ask any questions. During your school years, you experienced some long-term effects that influence your cognitive development. Could you briefly tell us about that?
So basically for me at that point, I was still trying to figure a lot of things out, and being a teenager, going through all the emotions, you don't quite know who you are. But cognitively, I really struggled with anything that's mathematical. So more, I want to say the logic aspect of things. Um, so it took me a bit longer. And unfortunately for me, it didn't mean that I wasn't bright, but people assumed if you took longer to figure a question out or trying to articulate yourself, that you weren't that smart. Um, and mathematics I really struggled with, and that's unfortunately it followed me when I went from grade 11 to go to matric, and then obviously you want to go to university, you want to do the different things, then there's certain benchmark things that you didn't quite get there, but when they did test you, everything's fine, everything is normal, you just needed a bit more attention, but you didn't fall in any of the criteria of, okay, you're dyslexic or you have an actual learning disability, because you don't. It's just you took a bit longer. It was just one of those things.
Yeah, it's so sad to hear how children sometimes are stigmatized unnecessarily when they are on cancer treatment, or on if they experience different medical conditions in their life. So in 2012, you were diagnosed with polycystic ovary syndrome, coupled with some hormonal imbalances. Did anyone ever speak to you about a healthy body image or your sexuality as a survivor?
No. So I know, especially coming from like my environment in my household, we're very conservative. We were intricate, Afrikaans mensies. So those things you never talk about. So I've at school and as you go through university, people spoke about a body image, and you saw that sort of starting on social media and that stuff. But no one ever approached me about sexuality with regards to survivor. You had to figure it out. Like,
yeah, I think it's a huge gap in our treatment and our psychosocial support of our teenagers and our patients, that we don't talk about it. But a few years ago, you had you received the very sad news that you couldn't have children. What went through your mind when you heard that?
so I almost want to say, I asked Audrey, how honest can I actually be when we talk about these things? For me, I was going through the weird phase where I wasn't old enough to be in a certain survivor group, but I wasn't young enough to be in another survivor group. So I was sort of in limbo. But for me at that point, I was going through other stuff also with, I would say, life insurance and that stuff. So for me, getting the news of, okay, here's another problem that cancer caused, because yes, I had leukemia when I was really young, but I don't think me or my family actually fathomed what the actual effects were going to be. So when when the gynae told me I have polycystic ovary syndrome, that was already like a truckload of just, I don't know, just such pressure to put on me. And then when they confirmed, okay, but I have more than 80% chance of not being able to have children because of the hormonal imbalances that radiation and that the chemotherapy caused for me. And knowing me and who I was, I always envisioned myself to be a mom. So if I'm very frank, this is how cancer screwed me over again. And I never asked for it. So it put me in a very negative space at that time. But yeah, it was devastating because it's something that I always wanted. But luckily now with new medicine and new technology and stuff and different things that sort of come out, that's no longer a problem. So, but it was a massive blow because no one knew how to talk to you about it. And also being conservative, they didn't want to talk about it because it's very taboo. And those are it's women problems. Vrouwmens probleme. It's like, you can't talk about it, or people get really awkward about even breaching that topic. So yeah, it wasn't great.
I'm sorry about that. I was very sad when you told me that you couldn't have children, but now you are in a relationship. Are you comfortable speaking to your partner about the fact that you can't have children, and did it have any influence on your relationship?
So my current partner, I'm very, very comfortable with. It's something that I brought up the topic very, very, very early on. Just that we're on the same page. He is very open-minded, so I've been very blessed in that sense of having someone like that. My previous relationship, unfortunately, it did influence it negatively, because as soon as you tell an individual, and not all, I'm not saying all men, but there's something wrong with you that you can't perform the basic thing that a woman is supposed to be able to do. So it did affect it, and it's a topic that was almost always cause arguments. So that was challenging in itself, because you're trying to figure out how you feel, and you're trying to also help adjust with your partner. But yeah, it wasn't a great experience. But luckily, the one I am now, he understands everything and he supports it, and he wants to know more things about it. So it's sort of been more reassuring than anything else.
That's good to hear that. Sometimes we journey through life to find the right person that you can really talk to and that can share your life, and they just accept you for who you are. And I think that is very important. How do you think healthcare professionals should talk to patients and survivors about a healthy body image, sexuality, and fertility? You can be blunt.
Okay, as you can see, I'm bringing epaulets and stuff. For me, I try and get into the mindset of, okay, I'm talking to my sister, or I'm talking to a close relative, or like a friend that I really trust, because it's not, oh goodness, it's not how I want to say almost it used to be, where you don't talk about it. Now with social media, with the different platforms, if you're scared to ask the question, you can always go to the internet or Instagram or TikTok or watch a blog or something, and they give you information. So for now, because there's so much information out there, it's also about the accurate information. So for me, at least, it's be honest, be as blunt as you can be, share your personal experience. So yes, I know being in a medical field, or whatever the case may be, it is kind of taboo to add that personal or getting too personal. But I believe if you're talking about your sexuality, they don't want to know the la-di-da, oh, it'll be wonderful, oh, it'll be this. You want to know you're really going to struggle with this. Like, get real with them, be blunt. And I wish someone did that for me, to just be like, this is what you're going to go with, that you know almost what to expect. So when you're having your moments of doubt, or when you're feeling at your lowest, you sort of know there is a brighter side to it. There is a flip side. It's not always going to stay this low, or this in this moment, or whatever the case may be. So for me, I feel health professionals need to just be more honest and more, I would say, blatant about things. And yes, we're trying to get the merge between being professional and being personal correct, because you want to show empathy, and you want to also appear, I would say, knowledgeable. But I just wish someone was just frank with me. Just, that's ultimately it.
Yeah. No, I hear you, and it's sad because I think a lot of childhood pediatric oncology patients and long-term survivors live in false information or not clear information about the way forward. And I think we need to be honest. We need to talk, call it what it is, and talk to our patients, because there's nothing like uncertainty. Knowledge is strength, and knowledge gives you wisdom to make informed decisions about your life. I do realize most of our cancer patients are very, very young. They are that you can't actually talk to them about these kind of things because they're 3-4 years old. They don't understand it. But then I think it's important that we inform the parents that when there's so many new technology, they need to make informed decisions and they need to have the right information.
Jennah, also to have the parents talk to the actual child, because for me at least, sorry for interrupting you, I could understand from the age of 7. I want to know what's going on. I want the doctor not to talk to my parents, talk to me. Like, yes, I'm 7 and that's klein, but like it's happened to my body, not my dad, not my mom, not my sister. Like, yeah, it's become a topic for me, like even as an adult, like talk to the person that's going through it. If you're not feeling comfortable putting it on their level, then get someone that can. Sorry.
Yeah. No, 100%. And that is a very definite and a very clear message that we need to send out. And not only to the doctors, but also to the children and to the parents. Ask the questions, ask informed questions. And to the doctors, just be honest, and the psychologists, just be honest with the patients and the children. Jennah, any special message to other girls in your position?
I thought long and hard about this, and it's quite loaded. But for me, I would say be excusably you. Like, ask the awkward question. Don't be shy, and just, whether you're male, female, be like, I'm a goddess, or I'm a god. And I know that's maybe controversial to say, but love your lumps and bumps. Like, your body's not perfect. I know I struggled because I had the scarf Hickman line on my chest. And that was sexuality and women breasts. Everyone asks, why is there a mark there? What is that about? Did you cut yourself there? So it's embrace your scars, embrace who you are, because it tells a story of what you overcame and that you're not weak. And that was a big thing for me, because you kept on telling like all the survivor things of this is a side effect, this is a side effect, but it's like, but I survived. I'm not a victim of cancer anymore. Like, I own you. Like, this happened to me, but I own you. So embrace your body, just with your healthcare provider, with your whoever you trust, be open and honest. Ask that question, explore your body. So I know that is taboo to say, but just figure out what works for you, what you love about you. Doesn't matter what your mom says, doesn't matter what anyone, if you like that freckle on your knee, then you like that freckle on your knee. That you just find something to love and be positive about your own body. And I know with social media, we see all these things and all these perfect people, but just find what you love and just be like, I'm a goddess. I overcame this. I mean, who can actually say they kicked cancer's butt? Like, not many people. So that would be my special message. Just love yourself and be unexcusably you. Don't apologize for who you are, and do not try and fit in a box, because you won't. You completely went out of the box when you survived cancer. So you're never going to fit the mold, and don't try to.
That is such a beautiful message. And you know, Jennah, there's so much maturity in that message, because we look at all these slim models and we look at girls that are in the magazines, but we are who we are. We have our own bodies, we have our own sexuality, and we need to get intact with that, and we need to explore and enjoy and be in the partnership that is really fulfilling. And it can only be fulfilling if you accept yourself your scar, maybe your amputation, maybe some things that you don't like. That is not the perfect body, but you are perfect because, as you say, you've overcome. And that maturity of accepting yourself, well done, girl. I am so proud of you. So proud of you. Thank you, Jennah. Don't go away. There might be questions that we will ask afterwards.
Perfect.
So our next speaker is Dannika Henman. Where is Dannika? There you go. There you go. Dannika, welcome. Thank you so much from the KZN to joining us today.
Yeah, I'm actually in Cape Town as well at the moment. Yeah, I moved to Cape Town.
Well done, my hometown, and it's so cold there, so I hope you're nice.
Very cold.
Yeah. Dannika Henman is a long-term survivor and was treated for acute lymphoblastic leukemia by Dr. Monica Verticalum in KZN. So I'm so glad when the regional manager in KZN introduced me to you. It's a privilege to know you and to have you on the talk. So my question to you is, what is your biggest challenge as a long-term survivor post-treatment?
Thankfully, I don't have any, well, not that I know of any physical long-term effects, but I do struggle quite badly with anxiety and issues with my body image. I'm getting better about it now with my body image, but I certainly went through a very, very dark period in my teenage years with body image and self-esteem.
Mm-hmm. So you shared a very interesting story with me. You said that when you lost your hair, growing up on a farm, being a little tomboy, people thought you were a boy, but as a girl, you were dressed in pink. What went through your mind as a young girl, and how did you cope with this? Am I a boy? Am I a girl? Who am I?
Yeah, so for me, that was before chemotherapy and all that, before I lost my hair, I very much dressed how I wanted to dress. I had a younger brother and older male cousins, no female cousins that really came to play on the farm. And I sort of could dress how I wanted to. And because I had long hair, everyone knew I was a girl. And as soon as I lost my hair, even if I was wearing, dresses and all that, people assumed that I was a boy. And to me, that was because I felt like they thought that I was too ugly to be a girl. People were staring, the way people would talk about me, I didn't handle it well. So I sort of forced myself to be more girly than I was comfortable with, because then I had to prove to them that I was actually a girl, that I wasn't a boy, that I was a girl. And I felt like I had to prove that to them. And it really, really negatively affected my self-esteem.
It's very interesting. So does that experience now have an influence in your life?
For a while, it still does. The effects of that. Sort of going into high school, I sort of started to reject anything more feminine, covering up my body as much as I could, because that was something that I had control over. Before, I had control over trying to be girly, but to me, it wasn't really a true control. So in high school, I was covering myself up as much as possible, just like trying to hide my body, because then I had control over it. And only recently sort of have I started to come out of that bubble. This year I bought my first bikini, buying dresses, and just
good girl,
trying to be comfortable with my body. And it's really hard. Like as Jennah was saying, I've also got a scar on my chest from a port. I've got a central line scar on my upper arm. Like those were things I was very sensitive about. And only recently have I started to get like, well, this is my body. If you're looking at it and if you got a problem with it, that's your problem. It's my body. And if I am comfortable wearing a top that shows off my chest and my scar, then that's what I'm comfortable with. And someone else's problem is their problem. It's not my problem.
It's your problem. Yes. How important do you think it is for people to talk to adolescents and young adults about sexual health?
It's absolutely vital. Everyone here keeps on mentioning the topic taboo, but something is only taboo if we treat it like it's something to be ashamed of. And survivors have gone through far too much to be ashamed of their own bodies, especially. I know I felt when I started sort of figuring out my sexuality, I was a nervous wreck, honestly, because I reached those goals a lot later than my so not the goals, but like the milestones of wanting to date, figuring out who you're interested in, a lot later than my peers, partially because of when I was sick. I missed out sort of those formative years, 9, 10 years old, not socializing. So my EQ, my emotional intelligence wasn't as advanced as it should have been for my age. And some part of that probably also has to do with the fact that I am pansexual. I'm not heterosexual, not straight. So that delays it slightly more. So it was very sort of alienating to my peers. I'd been sick and then separated from them that way. But then sort of reaching the milestones later, that was another alienating moment, another moment where my peers had already surpassed all those milestones and I was sort of left behind. So just as I'd started to sort of catch up to my peers, I felt like I was completely left behind again, and it was quite hectic. So being able to talk to survivors and give them those tools so that they're not left behind as much as they could possibly be is very important.
That's very interesting that you say that you were behind, because in a lot of cases, the girls go into an early menopause, and then they actually sort of it's a flip coin. Either you struggle to get on par with your peers, or you are far before your peers. So it's interesting what you went through, but I'm glad that you're starting to find your feet, and that you're starting to realize, I'm Dannika. I am who I am, and I am okay in my body and in my sexuality, because that is very important, that you are so comfortable in it, because that will give you that maturity and that self-confidence to go out and just enjoy who you are and not be scared of a scar or something different in your body, because every scar in our lives, that is what makes us who we are today.
Exactly.
Do you have a special message for doctors, nurses, social workers on how to speak to adolescents and young adults about sexual health and sexuality?
Just to be honest with them. They've been through so much, and after sort of you're done with them, not done with them, but sort of sending them out into the world, you want them to be able to take charge of their health. And one of the ways that you can do that is giving them the right information. As Jennah was saying about the sources of information, you want to know that it's factually correct. You need to give them the right tools, the right information. Also because, well, for me personally, like there's far more destructive things that I could have done to my body than covering it up. And unless, if you want to reduce the risk of them being self-destructive in ways that can really, really hurt them, you need to give them the information. If nothing else, if you're not worried about, oh, well, they're going to be a bit behind. If you don't want them to go down that self-destructive pathway, you really need to give them the tools to go forward into life on the best foot forward.
Yeah, absolutely. And I think also another thing is when survivors go for as a long-term survivor for follow-up treatment or for follow-up on maintenance, I think it's important for the doctors and for the social workers to ask the patient, do you have questions about your sexuality or fertility? And we need to be honest about it.
And to bring up those topics first, almost, because it's a bit embarrassing to ask, well, what about this and what about that? But if you can just not necessarily lead the question, but to prompt them a little bit.
Yes.
Like, this is an okay question to ask me type thing.
Yeah, 100%. Dannika, thank you for your honesty. Thank you for your boldness to speak on such a sensitive topic. I salute you, and please go out there and love yourself and love your body and just enjoy who you are. But please don't go away. I'm still waiting for questions in the chat. But now it is my privilege to introduce you to Mandy Rodriguez. Mandy is a clinical psychologist in private practice. She has been involved in the field of infertility for more than 30 years, working with individuals, groups, and couples. Her research has involved looking at relationships between stress and infertility. She works with individuals and their spouses in trying to deal with their fertility journey, including making decisions like egg donations and surrogacy, and this might include the spouse. We often forget about them, eh? We must always also include them. She offers support for couples going through IVF and deceased donors embarking on donor programs. She has appeared in numerous magazines and on numerous television programs regarding infertility, the emotional consequences thereof, and the management of the journey. It is a journey that she's passionate about, having gone through a few miscarriages and IVF procedures to have her own children. So Mandy's got an interesting journey. She's a cancer survivor, but fortunately was diagnosed at 42 after she had her children. So glad you are well, Mandy. And yeah, she's also suffered infertility in her 20s. So she's been through both journeys, although not at the same time. Mandy, thank you so much for being on the program today. And thank you so much for I'm looking forward to your presentation and to hear what options there are and the beyond, and how should we talk about it. Over to you.
Thank you, Audrey, and thank you both, Dannika and Jennah, for your honesty. And I love the way you spoke about your cancer journey, because it's very much what my talk is about. So I'm a clinical psychologist, and when I was in my kind of mid-20s, I realized I was going to battle with infertility. And I went to a fertility clinic. I decided I'm going to look at my options, and I went through numerous miscarriages. And I then had to do IVF. And ultimately, I had my 3 children. And when my little one was 6, I was diagnosed with breast cancer. So my practice is all about the kind of, how can I say, the ills I've been through, and I found some story to actually work with them. So that's why my focus is very much women's health, cancer, and then infertility. And both of you mentioned, the fertility journey, which I'll get onto now, is very emotional. But the cancer journey itself, even though childhood survivors may not remember, it distinctly, somewhere in your mind, there is this, I call it the BC and the AC, before cancer and then the after cancer. And when I look at my life, that's how I describe it, is my cancer was 10 years ago. And I remember at the time being blissfully unaware. I had my kids and kind of thinking, I've got everything I need and I'm going to work harder, and blissfully unaware that anything could go wrong. And when I got my cancer, the biggest thing for me was double mastectomy, and they wouldn't do nipple sparing at the time. So I refused to go to any oncologist that I knew in Joburg, and eventually took months to decide to go somewhere where they could save the nipples. And then it was chemo. And it's the first time I've understood exactly what self-esteem and body image is about, but most important, that huge sense of disempowerment. And what I talk now about decision fatigue, because I think once we've had cancer, and then possibly there's something in terms of fertility and beyond, we actually become, like you said, Jennah, is plagued with all these insurance matters and medical aid, and then suddenly you're faced with infertility. And here you get given all these options, and the doctor kind of expects you to make that decision, which is very hard, and you just get overwhelmed. So just to touch on starting the conversation, we do know that cancer treatment may affect a child's fertility. And when we look at a treatment plan, we establish whether the risk is high, moderate, or low. And there are many options that we can do for a child before they begin their treatment. But again, I must say, just like the two of you alluded to, now that social media has become more active and people are looking holistically at fertility and having these conversations, it's only the children maybe that are going through the options now or treatment plans now that are benefiting from all the work that we've been trying to kind of make overt over the years. So there's a lot of parents or kind of childhood survivors where their parents did not think of their future fertility, because I can imagine as a parent, you're so focused on your child's immediate treatment. And, you know, when you look about topics on fertility, it's often uncomfortable to address with children. So just if we had to look at the gold standard, kind of what do? We get our diagnosis, we look at a treatment plan, and then assess fertility risk, and then check if the patient is interested in fertility preservation. So if I look at my patients in their late 20s, late teens, they tend to be asked those questions because I do sit on the board of SASREG, which governs reproductive centers in South Africa. And it's now an accreditation and a guideline that the clinic has to say to a patient within 72 hours of diagnosis. The oncologist is supposed to then allow them those options of what do we do to preserve your fertility? Do you want to make this option for your child or not? So SASREG has got these guidelines that say to doctors in private practice, reproductive medicine health specialists, because we know IVF is very expensive, is that patients need to be seen 72 hours after diagnosis. And there needs to be somewhere that we can ease that financial burden. Just to look very briefly, before I get into the emotions, what can females do prior to puberty? So we do know the story of little Mackenzie, Mighty Mac. It was on carte blanche. Mac was diagnosed with cancer when she was 4 months old, and they did ovarian tissue banking and then started her treatment. So that is kind of a taking your ovary, taking it out, a piece of it, and freezing it, and then having to put it back after the patient has undergone their treatment or when they're older. Or if they're older and they are already menstruating, we can freeze eggs. Okay, so there are those two options. If we look at boys before treatment, it's very hard, obviously, to get a sperm sample. And how do you explain that to a little boy who's not even hit puberty? There is a way that you can get sperm from the testicles via surgical extraction, or the older males, once they're in their teens, can actually give sperm again to a clinic, which would freeze it for up to, I mean, I've had someone who's 30 years down the line has just had a baby. We do know, however, the discussion of sexuality comes into all this. I wanted to speak about females first of all. And again, this is historically, I'm not talking about now when we're trying to raise a non-gender specific population, but years ago, we were kind of socialized into playing with dolls. Boys were socialized into being the provider. And I think from young kids, there's always just that assumption, even if we don't want to be parents, even if we make that choice that I don't want children one day, we always think we've got the choice. We think we have that active choice to say, I choose not to be a parent. And I think that's what cancer and infertility robs you of, is choice and this huge sense of disempowerment. So I looked at some research as to why parents are wary of speaking to their kids about reproductive health. And the number one reason that came up was, I'll just wait until they're older. Now, we've got to understand that reproductive health is not just about sex. It's not just about puberty. It's not just reproduction. It's the whole lot. It goes across the lifespan. And like Audrey said, you'd be a patient like me. My first chemo dose after my mastectomy, I was straight into menopause. So it's not just for the youngsters. It's going all the way through the lifespan, even for those that get diagnosed later. Parents said, if children think about sex, they'll want to do it. And in fact, if you look at all the research lately, it's actually the converse. If children speak openly about sex and reproductive health, they make more informed decisions about their future sexual health. People believe the school will teach, and I am part of a group, IFASA. They have their own, it's an NGO, nonprofit organization, which is the voice for the patient going through infertility. And they are now trying to say, not only to government, but private schools, is when we do LO, let's make decisions, let's talk about reproductive health as well. Because, you know, in school, in LO, you're teaching about how to avoid sex, how to do barriers against falling pregnant. We're not bringing up, what about an eating disorder in adolescents, steroid use, STDs? What impact is this going to have on your future health? And then a further study said, well, kids don't want to hear it from their parents. And in fact, when they looked at children with well-adjusted kind of body image, 52% of them had been told or educated about reproductive health, self-esteem, body image from their parents, and only 17% from friends or social media. I put this slide on because at school, and prior to us realizing we may have an infertility problem, we are educated to avoid sex and to practice safe sex, but nobody gives us that education as to family planning. And, you know, 1 out of 6 patients, generally in the world, 1 out of 6 couples in South Africa have got infertility problems. And when I looked at the stats, 1 out of 5 cancer patient survivors will have fertility problems. So I want all of you who are actually childhood cancer survivors to realize that the stats are very good, and modern science is empowering us with more and more choices. We just need to expose people to these choices. So the big question when I see a cancer patient or someone presenting to the clinic is, will I be infertile in terms of the future? 80% and more of survivors have questions about fertility. But the sad thing is that very few doctors, very few oncologists, very few parents discuss these options. I looked at 2 studies. I listened to the talk that of the webinar last month, and they also found similar stats that the minority of children or teens actually preserve their fertility. Only 45% of boys, because let's face it, it's easier to give a sperm sample, and only 23% of girls. And in fact, the webinar that I listened to last month by Chuck was that it's even a lower percentage of girls. And the problem is there's very few psychologists or counselors who are trained to cope with 2 major life issues happening simultaneously. Because infertility itself is an entire journey of grief and loss and kind of constant cycles every month. Cancer in itself is a whole journey. And we're starting to realize now that the significant effect that post-treatment and post-cancer treatment and body image has on quality of life going forward. Just from the study last month, they did say that 86% of female cancer survivors and 74% of males have a desire for children. So even though we tend to think that a whole lot of the world is now saying, well, I choose to be childless, it's actually showing a high percentage of cancer survivors are looking for information. But again, they're showing how few people actually seek fertility preservation before. But the interesting thing is, cancer survivors do present earlier at fertility clinics. And this is a trend we're starting to see now, which is great with exposure. The big similarity with cancer in terms of infertility is this lack of control, lack of fitting in and belonging, and this lack of helplessness or disempowerment. And we go through all these issues on the left-hand side, the self-esteem and guilt when we're struggling to have children, the doubt, the shame where we start having fertility conflicts with our spouses or our partners, anger, we withdraw, and we start questioning our values. Now, my problem with family planning and fertility, and both of you, Dannika and Jennah, alluded to this, is we need to almost make the journey going ahead predictable for the patient. We need to give them the options, and there is a way to be warm, congruent, and empathic as a health specialist, and sharing your journey like I did without actually being pitiful or without actually breaking down as the therapist, but was sharing the facts and giving people the possibilities and almost doing some sort of roadmap going forward for them. We know that anything like cancer or infertility goes through this grief cycle of shock and disbelief. And I'm sure you all remember when you were diagnosed, or at least your parents would remember, is this kind of shock, disbelief. It's like a movie. And then we start getting angry, and then we wonder why, and we try and bargain, and we try and find a reason. And then we get down, and then there's some sort of acceptance going forward. Well, the same thing happens with fertility. And in all my years of doing fertility counseling, the denial of giving patients the option is worse than giving them the options that are available. Now, people will often sit and say, well, if I go and see a reproductive medicine health specialist to kind of find out my options, I'll be forced to do IVF. And that is a complete misnomer. Going to a fertility clinic does not imply IVF at all. The worst that can happen is you discover a map going forward, or you get peace of mind where someone's saying, you know, this is the clarity. Let's get you to support you to the fact that possibly you won't be able to have children. I'm not going to go in too much detail about this. It will be on the slide. I want you to show on this slide that a misconception is that everyone who's having sex falls pregnant every month. But look at that on the right-hand side. Natural conception, a healthy 30-year-old female with a healthy, normal reproductive system in a relationship with a healthy male only has a 20% chance of conceiving every month. So for the average couple out there, 1 out of 5 months, and that's with nothing wrong, they will fall pregnant. So I'd like to give clarity that we may be the 1 in 5 in terms of our cancer treatment, or the 1 in 6, pretty similar compared to the normal population stats. But look at the healthy people. They've only got a 1 in 5 chance per month. Now, there are ways that we can try and improve our fertility with weight and BMI. So if we have a look at lifestyle, and this is what I'll get to on my last slide, even if we know a road forward in terms of your fertility treatment, I can promise you, if you manage your self-induced stress, which we are starting to see with more breast cancer patients, more lifestyle type of cancer patients as they're getting older, stress does play a big part, this old type A behavior. Diet, in terms of let's try and keep your insulin at a good level so those hormones don't go up and down, that we can maybe produce healthy eggs, even if we've only got a few eggs remaining, or if the treatment has impacted on your eggs, we can still make an impact by managing diet and by taking in the right nutrients. So for all of you out there, I think it is so important to establish, if you have regular cycles, that doesn't mean that your fertility is fine. You need to have your AMH levels checked, which is your number of eggs remaining, to see how it is for your age. And that could be very good, or it could be you're 20 and you only have the egg reserve of someone of the age of 40, because our eggs decrease from the age of 28. But if we can get a level sooner rather than later, we can then give you the options of egg freezing. We can check your other blood levels to say, is there a thyroid problem? Is there something else contributing to that? Seek advice from a reproductive medicine specialist and a fertility counselor. And the reason I say fertility counselor is fertility is a very emotional journey. You cannot just go to any counselor and ask them about stimulation and ask them what the journey is going to be like, because we need to be trained in terms of what the hormones do to us, in terms of what the medication is going to do. And that's where my point goes, check your resources. And like Jennah said, or both of you said, check the right resources. And in South Africa, that would be SASREG or IFASA. And have a look for a fertility specialist that can give you that peace of mind. And they all have different personalities. I love saying we all go to the same conferences. We all go to Europe, to ESHRI. We go to America to the same conferences. So the science is kind of not standard, but just like a cancer treatment, it is there. But the personality of your fertility specialist is what's going to differ and is what is going to give you that passion to go forward or not. Again, they're going to start off with an ultrasound, possibly a semen analysis and blood tests. For the females, probably medication, if any of those are out, and maybe a laparoscopy. And then for the males, possibly medication as well. The three things you can do for yourself are diet, nutrients, and managing your stress. And when I say diet, it is not rigid dieting and avoiding all carbs. It is basically a classic Mediterranean diet, just where we're getting your insulin levels to be stable. And remember, there are many options in terms of having a family. When I see patients and they have to be assessed eventually for donor eggs, because that's nobody's choice. We don't come into this life believing we're going to have to use someone else's DNA. They cannot even say the word donor. And after one or two sessions, it becomes a part of their narrative, and it becomes something that you kind of form a cognition to and you get used to in some sort of way. So it's the same with fertility. We go through a basic of artificial insemination. Then there's ICSI or IVF. And patients think, well, that's the end of the road. Now they've got to go to adoption. But it's actually not. As we look through that journey and give patients the option of, if IVF doesn't work, there are agencies, fortunately, for donor sperm, donor eggs. They're agencies that we can take a donor sperm and a donor egg for the single moms and put it in the mom. There's surrogacy as an option, which we're using with a lot of our patients who are on long-term estrogen treatment or estrogen positive cancers. And then adoption is in that equation, but there are many other options if you want to go to adoption as a separate option, or if you want to go there last, or maybe you want to do it first. But what I'm saying is there's many options before we have to look at being childless. And the message I want to give all of you is most survivors fulfill their desire for children. And I've always loved this slide where we need to remember when we go through this journey, just like cancer, the cancer is the problem. The infertility is the problem. It's not you. And I invite you to follow me on any of my platforms, because what I started before COVID was doing a minute video clip every day, describing the different fertility options, interviewing donors, interviewing surrogates, just giving people a kind of an easy road kind of going forward as to what the options are. And they're all available on social media, and there is a free stress test that you can do there as well. And I thank you very much for your time this evening.
Wow, Mandy, thank you. As they say, knowledge is power. And I think this knowledge, I hope, will help a lot of survivors to make an informed decision about their future, about having children or not having children, about how to talk to their spouses or their partners. So there's so much information, but what is so amazing is the fact that there is help available. There are experts that can help you through the journey to make the decision, that there are options. And medical science have developed so much over the past few years. So for me, it's positive because it feels like there is hope. There is hope. So thank you so much for sharing your information and your knowledge and your personal journey with us. It's sensitive and it's not easy as a woman to talk about, your journey, but you and Dannika and Jennah did it so bold, and I really appreciate the time that you took to share with us this information. And I know somewhere there is a survivor who's watching and who is going to say, thank you for the information. It made a difference in my life. So unfortunately, we didn't get any questions in the chat this evening, which was quite strange. But this recording will be available on YouTube. It is on Facebook Live. And I want to thank everybody who participated. Thank you so much. And thank you for everybody who attended. I really appreciate that. I also want to thank Wayne from our technical team, from the brand race. I always appreciate your help and bearing with this baby boomer on the technical side of the things. And to my colleagues, Taryn, and I see Mama Brenda's on, and all of you, thank you so much for being on tonight. We have still one webinar coming up on the 26th of July. And then we will talk on assessing and addressing the sexual self of childhood cancer survivors. Our speaker will be Dr. Sage Balti. She is from Fairfax in Virginia. And then we have a male and a female survivor who will share their stories with us. But remember, share the YouTube link and let tell your colleagues and your friends about it. And then my message as last time is, go out there, love your bodies, love your partners, enjoy your sexuality, live your life without shame or blame. And remember, you are a very precious woman and you are a very precious man. Thank you so much for joining us tonight. Go well and God bless.
Thank you.